I saved the MAR form for last. The best way to learn is to break it up in steps and systematically fill the form out. I want you to write down all of the steps on your worksheet. We will start with a discussion and I will show you examples. Then we'll be completing the example together. I would like you to print out the MAR so you can write it in. Later we will be doing some interactive video that will allow you to type in the responses similar to doing the MAR exam. If you will complete the exercise, you should understand what to do to pass your MAR final exam. Please be sure to contact me at pat@mededamerica.org if you're having problems and not getting the knowledge checks 100% correct. I will help and explain further. Remember, you must get 100% on the test to pass. Please just follow the steps and you will do fine. First, I will teach you how to set up a new MAR and perform all the tasks necessary to keep your client's MAR accurate and up to date. We will be doing a number of exercises that will set the foundation, then build on it until we have a completed routine MAR and a PRN MAR with examples of tasks you must be able to perform. Please review the things I have listed for you to be on the lookout for. They will help you focus on the objectives for this section. In this lesson, we will be setting up a new MAR and looking at the components of completing MAR entries. Please be sure you have printed 2 copies of both the front and back of the MAR so you can fill in the information as we go over it. Note, copies are included as part of your worksheet. If you print your worksheets, you will not need additional copies. When setting up a new MAR or completing a MAR entry, it should be done systematically. The system I will teach you helps to make sure everything is entered correctly and all the necessary information is included. Each task is divided up in steps and different parts of each step. Please either write them in your notes or on your worksheet. Do whatever you need to do to remember the steps and the parts for each task, be it setting up a new MAR, adding an entry, changing an order, or discontinuing a medication. By doing this, it will not only help your documentation accuracy, but it will make passing the MAR exam a matter of determining what you're being asked to do, then plugging in the correct steps and parts. In this lesson, we will be using the information for Jesse James. You may find the information for the corresponding exercises on your worksheet, or you should copy it from the slide at the beginning of each task. The month and year are July 2019. Your name is Pamela Carter. Jesse James is a 27-year-old female with cerebral palsy. Her medical history includes high blood pressure and anxiety. She is allergic to sulfa drugs and bee stings. She has no food or other allergies. You have prescriptions for the following medications. Lisinopril 20 milligrams PO daily in the morning. Prescription is written by Dr. Jones on May 1, 2019. The medication label says, Lisinopril 20 milligrams, take 1 tab by mouth once daily in the morning. Ativan 0.5 milligrams PO BID. Prescription is written by Dr. Jones on April 1, 2019. The label says, Ativan 0.5 milligrams, take 1 tab by mouth twice daily. Notice the label tells you to take 1 tablet, but the prescription doesn't tell you how many pills. The pharmacist will determine how many pills you will give when he dispenses the medication so the total doses will equal the amount ordered. If the strength on the order is different than the strength on the medication label, call the pharmacist and verify the medication that was dispensed is correct. On the test, if it doesn't tell you how many pills to give, it will be 1. Most of the time, the pharmacy will have a supply where 1 pill will be the strength for the amount ordered. The standard medication times. Morning med pass 7 a.m. Afternoon med pass 2 p.m. Evening med pass 7 p.m. BID 7 a.m. and 7 p.m. TID 7 a.m., 2 p.m. and 9 p.m. Bedtime 9 p.m. Step 1. First, we will focus our attention on the header of the MAR. If you're starting with a blank MAR, as we are in this example, you will enter the name of the client, the month, and the year. If the MAR has information on it, double check to be sure it is correct and matches the information for the client whose MAR you are updating. Step 1 has 3 parts. 1. Entering the client's name. 2. Entering the month. 3. Entering the last 2 digits of the year. Please enter them on the MAR on your worksheet. Then click to go to the next page. Compare what you wrote to the slide and correct any errors. Step 2. We will enter, or if they have already listed, confirm the client's allergies. Be sure to include medication allergies, food allergies, and other allergies such as latex, bee stings, ant bites, etc. It is essential the food allergies are listed. Often a food allergy can indicate the potential for a medication allergy. For instance, if someone is allergic to eggs, particularly duck eggs, there's a good chance they may have an allergic reaction to a flu vaccine. No known drug allergies equals NKDA. No known allergies equals NKA. You can also write no allergies or none. If the client may have no drug allergies, but they do have another type of allergy such as a food, bee stings, a latex, ant bites, etc., write NKDA, then the allergy or allergies they do have. Example, NKDA, allergic to latex and peanuts. Enter the information for Jessie's allergies on your worksheet. Then click to go to the next page. Compare what you wrote to the slide and correct any errors. Be sure to write the allergy or allergies on the MAR. Or if there's no known allergies, write NKA, none or no allergies. Never leave this line blank or write N/A. Remember, N/A means not applicable. If there are no known drug allergies but another type of allergy, write NKDA, then list the other allergy or allergies. Step 3. Enter the information for the medication next. Be sure to write the name of the drug, the strength of the medication, such as how many milligrams or milligrams per mil, how many or how much is to be given, and how often it is to be administered. You will also need to include special instructions if applicable. The best way to complete this step is to copy the information directly from the medication label if it is a prescription medication, or from the doctor's order or prescription if the medicine is an over-the-counter drug or supplement. Enter the information for Jessie's medications on your worksheet. Then click to go to the next page. Compare what you wrote to the slide and correct any errors. Step 3 will have either 3 or 4 parts. Often it will only be the first 3, but be sure to include the 4th part if it is listed on the label. 1. The name and the strength of the medication. 2. How many to take and what route. 3. How often to take the medication. And 4. Specialist instructions if applicable. Step 4. Write the prescriber's name. This could be the doctor, APRN, or PA who wrote the prescription. Also put the date that is on the prescription next to the prescriber's name. Enter the prescriber's name and the prescription date on your worksheet. Then click to go to the next page. Compare what you wrote to what is on the slide and correct any errors. Step 4 only has 1 part, but be sure you enter both the prescriber's name and the date the prescription was written. The prescription date will explain why some of the blocks at the beginning, when the prescription first starts, are lined out. It will also help you keep track of when the prescriptions or doctor's orders, which are kept in the MAR book, are close to expiring and need to be renewed. Step 5. Enter the time routine medications are to be given. Most group homes and providers have set times for medication passes. When assigning the times, read the label carefully to be sure there is not a specific time or number of hours between doses. There is a considerable difference between 4 times a day given at 7 a.m., 11 a.m., 3 p.m., and 7 p.m., and every 6 hours, which is 7 a.m., 1 p.m., 7 p.m., and 1 a.m. Enter the times the medication should be given on your worksheet. Then click to go to the next page. Compare what you wrote to the slide and correct any errors. There is only 1 part for this step. However, you will be adding 1 or more times for the medication. The times are based on how many times you will be giving the medications in a day. Use the directions on the label and the standard med pass time set up by the provider or facility. Always double check for specific times or the number of hours between doses that may be included on the prescription or doctor's order. After you have entered all of the medications on the MAR, go to the bottom of the page, sign, then initial. Always double check that you have initialed and signed all of the MAR pages that you will be using for your documentation. Failure to do this could cause you to fail the MAR examination, or if it was a client's record, cause the provider to receive a citation of noncompliance if a monitor notices that you have documented the MAR but failed to sign and initial the form. Sign and initial at the bottom of the page of your worksheet, then click to go to the next page. Compare what you wrote to the slide and correct any errors. Step 6 is the last step for the front of the MAR. It has two parts, even though intuitively you may think it was only one since they go together. 1. Sign the MAR. 2. Put your initials in the box next to your signature. For the MAR final exam, when you answer and enter the name and initials, be sure you use the name that you are assigned in the question, since the program will be looking for a specific answer. To complete setting up a new MAR, we will move to the back page of the MAR. You may have several back pages attached to the front side of the MAR, dependent on how much information needs to be recorded on the back of the MAR. Be sure the client's name is on each of the pages. I have a separate section to teach you how to properly document the required information. For this demonstration, we are just looking at preparing the MAR for use. We're at the last step, and it has 3 parts. 1. Be sure you write the client's name at the top of the page for each blank page attached to the MAR. 2. Place your signature. 3. Write your initials. Enter the client's name, then sign and initial the bottom of the page of your worksheet. Then click to go to the next page. Compare what you wrote to the slide and correct any errors. You should now have a completed MAR page with corrections, if any. Use the steps, complete it systematically, and you should have no problem setting up a new MAR. We are going to build on this foundation in the next section. Keep this MAR, you will be adding to it. Please get a highlighter also. You will need it for the next lesson.